Welcome to Hacking Health. This podcast is for future-focused health experts, thought leaders and change makers who are interested in making health accessible for everyone, because together we can get to the future faster. I've loved our latest interviews with Laura Simmons and Dr. Natalie Flatt, and I'm excited to get back into another deep dive looking at the themes and issues that were raised. While they each have their unique experiences and perspectives, there were some common themes that emerged from these two conversations. The first common theme to be analysed relates to changing societal attitudes. Both Laura and Natalie address common misconceptions and attitudes towards health, advocating for greater awareness, understanding, and destigmatisation of health issues. Laura emphasises the importance of embracing change and adaptation to promote health equity and access to information. She does this through co-design and asking the question, can I use it over here at each junction? Natalie addresses common misconceptions and myths surrounding mental health and advocates for destigmatising mental health issues, promoting self-compassion and recognising the courage it takes to seek help and make positive changes, explaining it's not a sign of weakness and one of the biggest challenges she faces, changing the culture. Attitudes in organisations flow from the top down, so it's important that owners and practice managers are aware that their attitude and behaviour can influence the overall practice attitude. For this reason, the practice documents should also include positive attitudes that align with broader public health policies aimed at promoting mental health awareness and destigmatisation. The next theme to discuss is the importance of early intervention and prevention in healthcare. Natalie discusses the benefits of early identification and intervention in addressing mental health issues, advocating for proactive measures to address symptoms before they escalate, stating early intervention is the key. Laura echoes this sentiment and emphasises the value of addressing health concerns early on to prevent more serious complications later by discussing how TheraTrack encourages the completion of activities and supports therapists and participants, especially in remote and rural communities where access to healthcare services may be limited. Addressing early intervention, prevention, and disparities in access to healthcare services, particularly in remote and rural communities, requires technology-enabled healthcare solutions. If telehealth is a service you are already offering or contemplating, check out uLegal's telehealth policy via the link in the show notes. Both interviews delve into the transformative role of technology in healthcare, delivering and improving accessibility to services. Laura's discussion focuses on the potential for innovation in allied health and therapy practices. As the founder and CEO of TheraTrack, a mobile app and web platform that enables allied health professionals to work collaboratively and create, monitor, and track custom therapy programs, Laura has utilised technology integration and automation to address inefficiencies in traditional therapy methods and introduce new ways of delivering therapy programs, enhancing the overall therapy experience for both therapists and patients. On the other hand, Natalie's interview explores the integration of digital platforms and telehealth solutions in mental health care, highlighting the potential it has to enhance accessibility and effectiveness, focusing on the importance of matching algorithms to suit the needs of each individual person and multimodal psychotherapy approaches, drawing inspiration from models such as BetterHelp. Natalie went on to co-found Connect Psych Services. Her focus on creating clinical user-centered solutions underscores the need for innovation in healthcare, as she was able to leverage technology to improve accessibility, convenience, and autonomy in accessing mental health support. As such, both Laura and Natalie's endeavours epitomise the ongoing shift towards a more efficient, accessible, and patient-centric healthcare landscape, driven by technological innovation. Collaborative approaches emerge as one common theme in both interviews, with Laura and Natalie both emphasising the importance of working together across disciplines and sectors to promote health and well-being. While TheraTrack initially began for paediatric OTs, it has since grown and expanded, allowing for allied health practitioners of all professions to communicate on one platform along with parents and patients, aiming to address the needs of all of its stakeholders. Similarly, Natalie emphasises the importance of collaboration and team effort between practitioners, patients, families, and workplaces to support mental health. Ultimately, both these discussions illustrate how collaborative approaches are certainly key to epitomising healthcare delivery and improving patient outcomes. In conjunction with collaborative approaches is the need for interoperability. As healthcare systems integrate various technologies, ensuring interoperability among different platforms and systems can be crucial. It may be essential for your legal frameworks to outline interoperability standards to facilitate seamless data exchange and communication between healthcare providers and systems. The last theme I would like to discuss is the holistic approach to health. Both Dr. Flatt and Laura Simmons stress the importance of taking a holistic approach to health, recognising the interconnectedness of various factors such as physical health, mental well-being, and lifestyle choices. Laura discusses the importance of balancing work and personal life to maintain overall well-being and productivity, knowing when to switch off and prioritising friends, family, and your mental health are crucial to avoid burnout. Additionally, the implementation of TheraTrack, improving access for patients to home programming materials and gamification features, encourage the completion of activities, supporting clinicians also with growing workloads and waiting lists, demonstrating an overall holistic approach to healthcare delivery. Moreover, Natalie discusses the interconnectedness of physical health, mood, and mental well-being, advocating for a comprehensive understanding of individuals' needs. Specifically focusing on the impact of sleep and nutrition on mood and mental health, Natalie highlights the need to consider dietary and sleep habits in addressing anxiety. Together, both their insights underscore the importance of addressing the various facets of health collectively for a comprehensive, holistic well-being. By keeping these themes in mind, future-focused health experts, thought leaders, and changemakers can make health more accessible for everyone. Join us for the next episode, where we'll be joined by another health tech expert. And don't forget to keep the conversation going in our private Facebook group, You Legal for Doctors.